for today is typical cervical vertebra. There are 7 cervical vertebra in the body, C1 to C7, out of which C1, C2 and C7, they are the atypical vertebrae. C3 to C6 are known as the typical vertebrae. So this is the cervical vertebra, a typical cervical vertebra, and we are going to discuss this vertebra in detail. This is a typical cervical vertebra. On the anterior side, we have the body. This is the body of the typical cervical vertebra, and this is the vertebral arc posterior to the body that is connected through these pedicles right here. These are the pedicles, the bony pillars of the vertebra. Coming back to the body that is on the anterior surface, this is the superior surface of the body. It is concave from side to side. As you can see, it is concave and it has lips that project upwards. These are the lips of the superior surface of the body of the typical cervical vertebra, and they project superiorly. These are the lips that are projecting superiorly. The anterior border of this vertebra, it is slopy. As you can see, it is beveled or slopes. It slopes downwards like that. Coming back on the inferior surface of the vertebra, this is the inferior surface of the body of the typical cervical vertebra. Now, unlike the superior surface, it is convex from side to side. As you can see, it is convex and it is concave from forwards and backwards. The inferior surface of the body, it slopes downwards, as you can see here. So due to this reason, the intervertebral discs are hidden in the cervical region. Posterior to the body, we have pedicles. These pedicles, they are posterior and lateral. As you can see, they are not coming forward, they are not straight, but they go laterally. Due to this reason, the notch, the superior notch, as you can see here, the superior notch and the inferior notch, this is the inferior notch right here. This is the inferior notch. They are of the same size, and also due to their lateral position of the pedicles, the foramen, as you can see, it is triangular in shape. The foramen is triangular in shape and it is much bigger than the body of the vertebra. Projecting from the pedicles are the laminae. These are the laminae that are projecting from the pedicles, and they are much thinner on the top and a bit thick on the bottom. These laminae, they connect at the midline and further giving rise to the spinous process of the typical cervical vertebra. Now, as you can see, the spinous process, it is bifurcated. You see there is a division in the spinous process that makes it a characteristic of the typical cervical vertebra. The notch right here in the spinous process of the cervical vertebra, it acts as an attachment site for Ligamentum Nuchae or Nuchae. You can pronounce it as Nuchae or Nuchae, both are correct. Ligamentum Nuchae is attached at the notch in the spinous process, in the bifid spinous process of the typical cervical vertebra. Superiorly, we can see the superior articular process of the cervical vertebra. They are facing backwards. Since this is the posterior side of the vertebra, they are facing backwards and are flat. Whereas on the inferior side, we have the inferior articular processes. These are the inferior articular processes, and they are facing forward to the anterior side. They are facing forward and downwards. Now, one of the main characteristic of the cervical vertebrae is that they have a transverse foramina in the transverse process of the cervical vertebra. This is a major characteristic or the identification feature of this vertebra. Now, in the transverse process, this transverse process, it arises from the junction of lamina and the pedicle, as you can see, and it is pierced by a transversaria foramina. This is transversaria foramina. There are several features of the transverse process of the cervical vertebra. Right here on the anterior surface of the transverse process, there is an anterior root and a posterior root. This is the anterior root of the transverse process, whereas this is the posterior root of the transverse process. The anterior root, it is projecting laterally from the anterior side of the body. As you can see, it is projecting right here. This is the anterior root from the body, whereas this is the posterior root that is projecting from the pedicle. It's much clearer this side. This is the posterior root. This is the anterior root of the transverse process. Once again, this side, the anterior root and the posterior root. So the anterior root, it gives rise to the anterior tubercle, that is right here. Similarly, the posterior root gives rise to the posterior tubercle. This is the posterior tubercle. This is the anterior tubercle. Similarly, on this side, the anterior tubercle right here and the posterior tubercle right here. Anterior to the posterior root. Once again, anterior to the posterior root. This was the posterior root right here. And anterior to this root, we have Costotransverse Bar. This is the Costotransverse Bar. It acts as the passage for the cervical spinal nerve right here. Similarly here, you can see this is the Costotransverse Bar and this is the posterior root. Now the anterior tubercle of the C6, the anterior tubercle of C6 vertebra is the largest anterior tubercle amongst these cervical vertebrae, and it is also known as the carotid tubercle because the carotid artery can be compressed at C6 anterior tubercle of the transverse process.